It's just so much better when you've got a plan. Hi everyone, my name's Sarah. I'm a junior doctor working near London, and I'm so excited to be sharing videos providing insight from what it's like working as a junior doctor to getting through medical school and lots of other things. In this video, we're going to be talking about everything you need to know to excel on a clinical placement so that you're confident on the wards, make the most of your time, and actually reap lots of benefits and knowledge from it. Now that we've discussed tips about mindsets, I just want to give you some no-nonsense and practical tips that I think absolutely work for medical students and make their lives so much easier. It has absolutely done that for me, and as a junior doctor, I've seen it help other medical students on the wards. The number one thing I think you should do when you get on a ward is introduce yourself to as many people as possible. Otherwise, you risk being in a ward round with a bunch of doctors and a consultant, and nobody has any idea who you are and you're just tagging along at the end. Most of the time, you're not going to have a doctor or another healthcare professional come up to you, introduce themselves and ask you who you are. As the medical student, you need to actually make that step towards them, and it will do wonders for you. Take that first step. So just before the ward round starts, go up to the consultant and introduce yourself. People will then know who you are, and they'll know your level of competency as a medical student and will give you jobs according to that. Just a simple introduction will make you feel part of the team and make your learning experience so much better. It really is just as simple as saying, "Hi, my name's Sarah, I'm a final year medical student and I'm going to be on this placement for 5 weeks. I'm really excited to work with you." That's it. Following on from that very simple step of introductions, it's so important to voice your interest. If you already know that you really want to get good at clinical skills like taking bloods, or if you want to be super slick at examining body systems like the abdomen, for example, let the people around you know so that opportunities don't slip past you. If as a doctor I know that the medical student who's introduced himself has told me that they're really keen to take bloods, whenever I have a patient who needs a blood test, I will call that medical student. And that just makes their life so much easier because the opportunities are now coming to them. They've voiced it out to the universe, or at least their medical colleagues. And this is something that you can do on the wards with any healthcare professional. So I do this as a junior doctor with the nurses all the time. If I wanted to practice doing VBGs, I'd just let the nurses know and they'd be able to call me if there were a couple to do on the wards. I guarantee you that will make your time on the wards so much more efficient and productive with lots of opportunities. Now that we've talked about the things that you can say for opportunities to present themselves to you, let's talk about the things that you can do hands-on as well. As we've mentioned before about the things that you need to learn, remember a big part of it is learning about the logistics of a hospital and the day-to-day tasks that doctors need to do that you need to learn about. These include things like writing TTOs, so those are discharge letters that are given to patients once they leave the hospital, updating the patient lists or chasing bloods. Now these are all things that you'll hear junior doctors talking about all the time, and it's the part of medicine that we don't really talk about in medical school. It's really down to almost the secretarial aspect of the job that's intrinsic to being a junior doctor. So the next tip is be useful. We've already talked about the fact that you've got the luxury of time on your hands, something that most of the healthcare professionals you're surrounded with will not have. So if you're able to help the junior doctors to do some discharge letters for patients or to rewrite a drug chart, A, they will be eternally grateful to you and will invest more time in teaching you and finding opportunities for learning on the wards for you, but B, this is something that's super important for you to learn. Just by rewriting a drug chart, you will pick up on the ways that medications should be written and unconsciously be rote learning about the dosage and frequency of medications that you will be prescribing and administering as a junior doctor. One very important tip is about asking questions. Now everybody says ask questions, there's no such thing as a stupid question, but there is such a thing as a question becoming more inappropriate or more stupid as you get further into your training. So on day one, when you start off and you have a dozen questions about the logistics of the hospital and the clinical cases that you're inevitably going to see, as a medical student, this can all seem very new. I would urge you to ask those questions as they come. If you have no idea why a nasal cannula is used instead of a face mask to provide oxygen for a patient, just ask. The only way that you can learn is that you ask as soon as something appears new to you, and don't leave it for later because later it's going to be more uncomfortable. So you might as well get it out of the way. The next key point I want to highlight is have a plan before you get onto the wards, every single day. If you think about it, it's absolutely ludicrous to show up on the wards hoping you're going to learn something and not have a concrete plan of what you want to learn and how you're going to do it. It's like leaving the house hoping you're going to get something productive out of this without having decided whether you're going to go grocery shopping or for a run. Being on the wards is the same thing. You want to show up with a plan. So for example, one aim for a day could even be one of your logbook sign-offs. So on said day, you show up to the wards. As we've discussed, tell the doctors, tell the nurses, I really want to do blood tests today. Is there anyone I can practice on? If you had done your homework, you would know that there are phlebotomists or professionals who take blood tests from the patients every morning. So as a smart medical student that you are, you would have gotten this information, spoken to the nurses, doctors or phlebotomists themselves and said, could I please join on to that round in the morning? So in that 1 hour watching the phlebotomist take bloods and perfecting your own technique, you will have optimised your learning and gotten to a much further competency level than you would have if you had just rocked up to the wards and expected at some point that somebody might mention a blood test that needs to be done in the day. It's just so much better when you've got a plan. One of my golden tips for logistics and knowing what's going on around you in the hospital is to act like one of the doctors. Get the handover sheet. The handover sheet is the list that doctors get in the morning with patient details, what they've come in with, the investigations they've had, the management plan, and what the outstanding jobs are. That is gold dust, and all the doctors will have this. So as a medical student, you will be much more informed. When you're going on the ward round and seeing patients, you know who they're talking about, and you have a solid idea of who that person is to ground that clinical experience. Another super useful thing is having a copy of the Rota. Now this is the blueprint of what all the doctors in that department will be doing at all times during the week, from the junior doctor to the consultant. Because a big reason of why medical students miss out on learning opportunities is that oftentimes they don't know that a clinic is going on downstairs or that there's a theatre list in the afternoon. So if you have a particular favourite consultant or a doctor that you found is really good at teaching, you can make sure that you prioritise those sessions and experiences to get the optimum learning throughout your day. And it's really easy to get your hands on. Just ask one of the junior doctors and they'll happily forward the email to you. These are golden blueprints that most medical students don't know about or don't really think about when they start on the wards, but it will make your life so much easier because you'll have a bird's eye view of what's happening. That makes everything so much more manageable and helps you optimise your learning by picking and choosing the opportunities that you will find useful for your learning and will help you optimise your learning experience. I really hope you enjoyed this video, and if you did, please subscribe to show some support. And let me know in the comments down below what your experiences have been on clinical placements, or if you have any further questions that you'd like to ask me. See you in the next video.